So today we want to give you guys a little special, and then we'll get into some of the things. This is the first time I'm actually presenting this. I want to talk about, you guys know that we've been recently introduced our new product called Cata Vision. This is after 3 years of research that I've been doing on CBD and medical cannabis. I just completed a 7-month program that I was doing educating on the benefits. Why? Because I had a particular interest in brain and eye. Because early on when I first started using acupuncture and herbs for treating eye diseases, we all heard that glaucoma can be benefited through cannabis. So that was like, oh, okay, well, you know, maybe I can smoke and drop your eye pressure. But it started my interest about like 10 years ago. And I kind of had this thing that there had to be something to it. But over the last like 2 or 3 years, with the surge of the CBD industry and the interest in, you know, medical cannabis legislation changing and everything like that, I really became more and more interested because I had a lot of patients starting to use marijuana, starting to use medical cannabis and CBD. So I made it my business to understand, just like I understand stem cell and gene therapy. This is just something new that's coming. And there's a lot of misinformation out there. There's a lot of like, oh, yeah, somebody said take this. So I want to give you guys some information too, so that you understand not only why it's good, but how to use it and why, with the differences between different products. Not all CBD is created equal. Most of it's junk. I read an article last month that showed that they randomly took 60 bottles of CBD that just generally out on the market, and I think 60% of them didn't even contain CBD in it. Wow. The reason is it's unregulated right now. So that means you have to do your due diligence. I've done my due diligence and I've done all the research, so that's why I'm going to share this information with you. So we're going to talk about what's called cannabinoids. Cannabinoids are the constituents, all right, in the plants. We have phytocannabinoids and endocannabinoids. So we have the ones that are produced in our body, and we have those that come from plants. And specifically, we're going to talk about how they're used for optic nerve and retinal health in the entire visual system. So the first thing we want to look at is what's called the endocannabinoid system. All right? The endocannabinoid system was just found very recently in 1990. All right? Israel's been doing a lot of research on this. They're leading the research on cannabis. They have a very liberal healthcare system, and that's pretty much where all the research is going. Actually, Israel in the 70s, they're the one who isolated the THC molecule and found out that THC is actually what gets you high. You know, that's the active component in marijuana. But we're going to talk about something a little bit different. So the first thing I want you guys to understand is that there is this new system in our body called the endocannabinoid system. All right? This is a real system in our body. It is the largest system in our body. It connects everything. It's this network, like a web, that just connects every part of our body together. It's fascinating. So inside the system, what we know right now, again, this is really new stuff. So I'm giving you what we have as of right now. Right now, we know that there are a bunch of receptors. So the cannabinoid system is full of receptors, all right? It's similar to the nervous system, like opiate receptors, and we have insulin receptors, a lot of different types of receptors in the body. So what they do is they receive information, very much like a lock and key theory. Okay, that's why we use the lock and key. The general role of the endocannabinoid system is to maintain homeostasis and balance in the body, a dynamic equilibrium. It's always trying to move the body back to balance, which is very similar to how Chinese medicine takes their approach. If it's too hot, we cool it down. If it's too dry, we make it moist. If it's too cold, you know, we warm it up. If it's too damp, we try to dry it out a little bit, right? So if it's too excess or too hyperactive, we try to sedate it. If it's fatigue, we try to tonify and strengthen it. So it's similar in this regulatory effect. And again, we talked about being the largest network known in the body right now. So we have these 2 receptor sites. There are a lot of receptor sites, but the 2 main receptor sites that we know about right now are called CB1 and CB2, or CBR1 and CBR2. Cannabinoid receptor site 1, cannabinoid receptor site 2. All right? Generally speaking, the CB1 receptor sites are primarily focused in the central nervous system, the brain, the eyes, and the spinal cord. CB2 receptor sites are more distributed in the peripheral nervous system, digestion, and immune system. Okay, so that's important to know because we want to know where we want to target the specific cannabinoids. So we just know. So what that tells us is the research shows that in the eye, in the retina, and the optic nerve, both exist. Even though there is a relative majority of CB1 receptors, because we know that's primarily what we see in the brain and the eye, there are CB2 receptor sites in the brain and eye as well. So we know we have both of those. Okay, so you guys, it's kind of a general overview. You guys getting that? So all you need to know is there's this big system in the body that has receptor sites. Our body produces its own endocannabinoids. All right, there are two types of endocannabinoids, anandamide and 2-AG. The reason we have this endocannabinoid system is for our body to self-regulate. Now, because we've gotten so far away from eating plants and vegetables, and we've had so much synthetic technological stress in our lives, our body has kind of not produced much of this. All right. So basically, we have this endocannabinoid system with all these open receptors, kind of like a flower, like standing like this, waiting to receive, neurotransmitter input, but nothing's happening. So they're just kind of sitting there, like waiting to be regulated, but nothing's happening. So we use things like acupuncture and holistic living to stimulate the body's own production of endogenous endocannabinoids. But what's happened is over time, over the last 100 years or so, since there's been prohibition of medical cannabis, and it's not even in the air, it's not even pollinated, right? We don't have hemp infused into our food. The old animals, farm animals used to eat hemp. That was their diet. So we got the oils, we got the cannabinoids, and we got all that from food sources. We got that from pollination. It was in our food and drink and beverages, just part of our industry. Industrial hemp was a huge part, more than 100 years ago, up to 4,000 years ago. It's just the last 100 years when there's been, prohibition and stuff like that. So the effect of that is that we've become deficient in cannabinoids. So what we're looking to now to supplement these insufficiencies is through plant-based called phytocannabinoids, all right? And we found that there is one plant in nature that is exceptionally robust in its content of cannabinoids. That's cannabis, okay? There's hemp cannabis, which has 0.3 or less of THC. THC is the stuff that gets you high. And there is cannabis, which is called marijuana, which originally in its normal state had a pretty good balance of CBD and other endocannabinoids we're going to talk about, and THC. Basically, the old marijuana really didn't get you so high. Like the ones that use in endogenous tribes in India and China, and it was pretty weak stuff. It's been genetically engineered over the last 100 years to make you out of your mind, stuff like that. So it's just the way it's gone, and that's just consumer driven. So it's been genetically engineered to really whack people out. But to that, it's also been concentrated, and the concentration has also been shown to be quite helpful for certain medical conditions. So I want to take another quick step back. When we look at the human endocannabinoid system, the ECS is a representation we use for endocannabinoid system. We look at things like regulating body temperature, right? So somebody's too cold or too hot, it helps regulate body temperature. So things like menopause, right? People run too hot, or they're just cold all the time, thyroid issues, or just anemia. Right, yeah, hot flashes too. So it helps regulate the body. So we're using cannabinoids really effectively. And again, I know this about vision, but I figure we'll give you guys a little bit broad perspective here. Really effective in helping regulate the hormonal shifts that men go through too. Women go through menopause, guys go through adrenopause, where the adrenal glands in the testosterone levels shift. So it helps with that transition. Blood sugar levels. Diabetes, an issue these days, huge. One of the top 3 killers, right? Diabetes is huge. We can use some help with our blood sugar regulation. Our diet's horrible, we're not exercising, and most of the food we have is processed. We could definitely use some help with blood sugar regulation. We also know that it helps with our pH, right? Our acid levels. That's why we use alkaline diet, things like alkaline water that we use. Keeping a healthy pH that's not too alkaline, not too acidic is very important to overall homeostasis and wellness. It helps with the absorption of water and minerals in the body, the electrolyte and fluid balances in our body. We get edema, we get a swelling and fluid, or we get dehydrated because we get electrolyte insufficiency. It's very, very important. Metabolic waste, this is huge. Guys, with all these eye conditions, what is one of the main characteristics that are similar with most of these eye conditions? You all have ocular waste buildup. You got glaucoma, it's water excess, fluid excess. You got RP, you got pigmentation buildup. You got Stargardts, you got drusen, you got macular degeneration. Dry type, you got drusen buildup. You got wet type, you got blood accumulation that sits in status. So there's either there's an increase of metabolic waste holding on to the body's not efficiently getting rid of, whether it's solid or liquid. Of course, there's going to be gaseous as well. So again, the treatment and the therapy that we're going to use is going to be designed to stimulate the body's own endogenous production of anandamide and 2-AG. Those are what our body produces ourselves, and we're going to supplement to tone up the ECS. We're going to use plant-based, okay? Plant-based cannabinoids. So enter Cata Vision. What is Cata Vision? Cata Vision is our new CBD product. It is a full spectrum product. There are different types of CBD products. You have full spectrum. Full spectrum means it has 0.3 THC in it. Not nearly enough. You'll feel more woozy after a cup of sleepy time tea or a T-bone steak. You have there's no psychoactive effects from that. Right? It's not going to make you high. It's not going to make you loopy. Like nothing. But it is enough. It is whole plant. It's a whole plant. That's why I like full spectrum, because there's this thing called the entourage effect. And this goes through all Chinese medicine, Ayurvedic medicine, herbal medicine, where the entire plant, the whole is greater than the sum of its parts. Meaning if you use the whole plant, there's stuff in the plant that's useful, that's better than if you just extract the different, isolates from it. So if you isolate CBD, it's not going to be as powerful if you take a whole plant-based extract. Now, that said, we know that there are people who either have issues, they're not comfortable taking any products with THC in it, maybe children, maybe you're working, maybe you have to get drug tested for your job. If you take full spectrum, it will show up in your urine. So we have what's called broad spectrum. We have a broad spectrum CBD Cata Vision product that has no THC in it. All right, we don't have a lot of patients, but we have people who work for the state, we have people working for the airlines, teachers, or whatever jobs are still drug testing, which is going to soon become a HIPAA violation, because now that medical cannabis is legal, people are taking it. You can't test if somebody's medically prescribed for that. So there's going to be HIPAA. So the HIPAA laws are going to have to change around that. So we created that. Why did I create this? Again, because there's so much junk out there. There's so many patients taking this, and it took me a year to source a company that I liked. Now, this is a whole list of what it does. This is research-based. None of this stuff is anything. Actually, there's one on here that is not research-based, and I'll tell you exactly what that is. So the first thing that research shows is CBD and full spectrum reduces inflammation, without question. Right? Without question, reduces inflammation. And we talked about inflammation driving a lot of these conditions. We know that it's neurogenic. Neurogenesis means it actually regenerates nerve tissue. Proven. It's regenerative of nerve and brain tissue. Neuroplasticity helps the brain adapt. The whole visual system needs to adapt. We talked about that. Neuroprotective. We have to protect the nerves from what? From heat, from oxidative stress, from attack. They need to be coated and protected, right? Just like us. We don't run around naked. You got to protect. When it's sunny out, when it's windy out, we need to be protected. Antioxidant protection. We talked about the importance of antioxidant protection, oxidative stress, running, especially conditions like age-related macular degeneration. It is a disease of oxidative stress. So in addition, we talked about carotenoid antioxidants being really important. This is equally important, in my opinion. It's a different type of antioxidant with a slightly different mechanism, but it is just as equal of importance. Prevents angiogenic neovascularization. What the heck is that?
Yeah.
Angiogenic neovascularization, that is when you have new blood vessel growth, wet macular degeneration, and diabetic retinopathy. Anytime there's retinal bleeding, what happens is there's poor blood flow to the retina, so the body says, ooh, let's grow new blood vessels to feed the retina. So it does that. Those new blood vessels are very weak, all right, and fragile. So what happens is you get wet macular degeneration, you get bleeding. You go to the doctor, they give you shots of what's called Antivegf, which stops the bleeding. Guess what? CBD is its own Antivegf, and it stops the genesis of these new blood vessels because it maintains oxygen levels. When there's good oxygen in blood levels, the body doesn't need to grow new blood vessels. Okay? The biggest research shows that it helps with night vision. Hands down. Night vision is, the research has shown the biggest benefit of CBD and is to really help benefit night vision and dark adaptation secondarily. But every bit of research that you find for retinal health is going to show that night vision is, you're going to see that everywhere. Neurotransmitter conduction, all right? Those are the impulses that are carried from our brain, right? Our neurotransmitter is very, very important in brain function and vision. These are like GABA, serotonin, dopamine. These are all things that make you feel good, that make you feel healthy and, I guess, you know, things are good. Things are good, you know?
Yeah.
It's good. It's okay. I'm all right. You know? We got coronavirus, but it's okay. I'm all right. You know, I'm not freaking out. The neurotransmitters are dysregulated. Improves sleeps and restores homeostasis because it's regulating the central nervous system, right? We all know CBD is really useful for sleep, right? Helps the body restore its natural biorhythms, and the sleep cycle reduces stress and anxiety and panic and the, you know, the overwhelm that we're dealing with that. Just dealing with the vision stuff alone, you need to just, you know, chill a little bit. It helps. Supports vascular health, the flexibility of the blood vessels, right? What happens is blood vessels get stiff and they get hard and they break and they crack and we start bleeding and you get, you know, arterial sclerosis and atherosclerosis. So it keeps the blood vessels soft and squishy and pliable so that the blood can go through there. Tones the immune system, right? We talked about that. We have a hyperactive immune system, like with retinitis pigmentosa, Stargardt's, a lot of these conditions. It's autoimmune based, or you have a low immune system where the immune system isn't, you know, you have kind of maybe susceptible to eye infections or stuff like that, conjunctivitis. So we want to tone the immune system because a lot of these eye conditions, especially the genetic ones, have a lot, are tied into the neurological immune system. They're called neuroimmune diseases. That is not even on the radar with conventional biomedicine, but I know that because 60 to 70% of my patients with RP and Stargardt's and Usher syndrome, they all have family history. Somebody in their family has some type of autoimmune, whether it's thyroid, Hashimoto's, Crohn's, colitis, asthma, MS, you know, skin disease like eczema, psoriasis. There is something. Like we see that very, very often. So the first gen, I would say 60% of my patients here with retinitis pigmentosa are first generation. That means this is a genetic disease. Supposedly it's genetic, but at least half the people I see, there's no genetic component. So what does that mean? It means that your first gen and something caused the gene signaling to change and the gene expression changed. And also, again, lastly, we talked about it aids in the removal of metabolic waste. Drew, I suspect this. I'm going to be watching this over the next year or two when we do our OCTs, all right? I haven't proven this yet. This is still theory for me because I haven't seen it yet. It's going to take about a year, I think, a year to two to get this because it's a slow wash. We're looking for reductions in drusen, pigmentation. We know that it gets rid of CME, cystoid macular edema, and CSR. So any excess fluid on the retina, we know it gets rid of that. Not all cases, but most cases. We have a lot of patients who have used medical cannabis and in a day, like gone from like this huge edema thing to cystoid macular edema. See, it resolves it and keeps it away pretty progressively. So there's a lot of it. And one of my favorite, coolest things about cannabis, no side effects. None. Like none. Like you get a good night's sleep. That's it. Nobody has ever, listen to this, nobody has ever, I mean ever, died from cannabis overdose. Ever. Why? Because it doesn't go to the brainstem. There are no, we talked about the CB receptor sites in the endocannabinoid system. There are none in the brainstem. Alcohol, opiates, drugs go to the brainstem. That's why people overdose and they die. You can smoke too much or to eat a brownie and you could freak out, you know, you're not going to die. You can be stupid and go out and drive, you know, when you're high. So the behavior will get you injured, but the actual chemical exposure, no, risk-free. So that's what I love about it. Remember we talked about my criteria? Can't do harm. So, and that's, again, we're talking about just the THC with that, okay? So let's talk a little bit about, when we talk about the constituents. So again, we talked about full spectrum has a little bit of THC in it, not enough to kind of get you high or anything. So there's no intoxicating effects, but it is, I like that it has a little bit in there because it's this entourage effect that just makes it work better, okay? That's my preference. But I do appreciate there are some people who are kind of a no-go and a no-fly zone with that. So the Cannavision that we produce, the reason I chose this strain, it's a strain of cannabis, is because it's very high in a couple of things. It's very high in CBD. We know that that's the main component that we're looking at. And CBD helps with autoimmune. It regulates the immune system. We talked about that. Controls inflammation, helps with vascular support, will break up drusen, and also we know it's an anti-VEGF, which will help prevent going from dry type to wet type. Like, how awesome is that? Like, really, really good stuff. Then we have CBC, which is another. That's in very small doses in the Cannavision. You don't need very much of that. It is another very, very powerful anti-inflammatory. It also is a less powerful anti-VEGF. It also drops eye pressure. This is why I added this, because it drops eye pressure. There's been some talk, not really confirmed yet, that CBD in high doses may slightly reduce or increase eye pressure. I've tested it on my patients who've gone through using CBD. I have not seen that, anything significant, but just because of that, we made sure that the strain had CBC to make sure it has that eye pressure lowering effect, all right? We also made sure it has equal values of CBA, all right? Cannavision I wanted to make sure it has equal values of CBA. CBA also very, very important for cases like diabetic retinopathy and wet type or dry type macular degeneration, so we don't form these new blood vessels. It's anti-VEGF. Inflammation, and also is an antimicrobial. So we know that it's really powerful for helping regulate the immune system, right? If your immune system's weak, this is also really helpful for cancer. So antimicrobial is actually a really good antifungal, the CBA. So if any of you guys have like a fungal infection, like a toenail infection or anything like that, like yeast fungus, take some of that, just put it topically on, that'll get rid of it. So really good too. Women who are susceptible to yeast infections, awesome. Just taking it internally is like anti-yeast, antifungal, really effective. People have like athlete's foot, really susceptible to that, super beneficial. So I wanted to take this is why, and I'm just being transparent and disclosing why I chose this strain, because it's so high. So it's not just the CBD. Also, the product that we put together is very, very, very high potency. It's 2,500 milligrams per ounce. That is really high potency, all right? That means you're getting about 83 milligrams per shot. My research, where I'm at right now, I don't want, for a therapeutic dose, you have to be taking at least 100 milligrams a day, bare minimum. I like between 1 and 200. The more going on, I'm usually going to get you up more towards 200, right? So 2 drops a day, they're going to put you about 1,600. 3 drops a day is going to put you just over 200, which is fine. Again, no risk, totally safe. I do recommend that people titrate up the dose, especially dealing with kids. Start with 1 dropper a day. You know, half dropper in the morning. Then do 1 in the morning, half drop in the morning, half drop in the evening. Work up to it. You can't take too much. You're super stressed out, a lot's going on. You take another dose during the day. General recommendation is 2 times a day, sublingually, under your tongue. Hold it for about 30 seconds to a minute. Why? Because we're going to bypass the stomach. If you swallow it, you're only going to digest half of it. All right, under your tongue, it goes right into your bloodstream and bypasses the digestive system. You just get more bang for your buck. All right. On a side note, the absolute best and fastest way to get CBD into your system for the brain and the eyes is through vaping. But we're not really going to have people do that. It's just the fastest delivery to the brain and the eye. If somebody's in a pinch, that's why I have people who have retinal bleeding or retinal fluid. Like, we will recommend that they sometimes, there's a couple companies that we know that have really high quality vape cartridges for CBD. And again, I know there's all this stuff out with the lung stuff. That is totally unregulated. The nicotine ones, that is not the CBD, the regulated CBD cartridges. It's only the nicotine. It's because they're using vitamin E, when they should have been using other stuff. And the vitamin E got in people's lungs and it screwed them up. And again, that's just the nicotine vapes. But this stuff is very controlled. Nothing to worry about with that. But again, I'm not totally huge on smoking, unless somebody needs like a quick dose to kind of get it in their system. But that's just some research. The therapeutic dose, it says around 100 to 200 milligrams a day. We titrate up. The only thing I want you guys to know is it may drop blood pressure. So if you're on blood pressure medications, especially if you're older, just be careful with that. Please monitor your blood pressure. If you feel woozy or anything, the end result is you may need to take less of your blood pressure medication. So just keep note of that. And again, the reason I chose this strain is it really targets, because of the CBA and the CBD and the high potency, it really targets the brain and the eye and the central nervous system. Okay, so our goal is to invest daily in our vision, keep our eyes healthy and strong, and that's our outcome.